This is your booty after a BBL. Nice and perky, nice shelf, exactly how you wanted it to be. This is your booty many years later. Fat has increased and the fat is going up your side and down your thighs. So if you're thinking about reversing your BBL today, Beverly Hills-based double board certified Dr. Yovino explains what makes BBL reversal or BBR look beautiful or not. Stick with us to the end because he's going to reveal the one thing that determines what makes or breaks a beautiful BBR. Dr. Yovino, welcome to Beauty Seek.
Thanks for having me.
Absolutely. When patients come to you asking about reversing or reducing their BBL, what are they usually bothered by?
So it's really unique because they have a lot of individual desires, but I'd say overall it's a reduction, right? And so the BBR, that R stands for reduction, reversal, reshaping. It's a correction of some sort, but I'd say globally there's a reduction desired, right? With secondary reshaping and then specific desires where they might want the whole thing taken down, the outer part, the upper, the middle, the lower. They might just want the upper part. They might just want the middle and the hip, or the lower part and the lower outer. So every patient has like specific desires. In general, I'd say if you're going to give the R a word, it's reduction more than anything.
Okay, perfect. Let's talk about what during the consult for a BBR, Brazilian butt reduction, can lead to a beautiful or not result.
During the consultation, I really get to know the patient, right? I try to get a history of when did they have it done, how much was put into their butt. If they know how much fat was put in, that's great because I like to kind of plug that into my calculation of like what I need to be taking out to get to their desire. Were they initially happy with the outcome with their BBL and then they grew to not like it because they just fell out of favor with the exaggerated result? Have they gained weight? And a lot of patients have gained weight. Life happens, right? They might have gained 10 pounds, 20, 30, 40 pounds. They might have liked it initially and now it's too big. They might have felt like they were okay with the first one and then they had a second BBL and now it pushed them way over the edge and they wish they never did the first one, right? So they're trying to get back to their first outcome, or they're trying to get somewhere close to where they never had a BBL, but they don't want to lose their butt, so you got to really tease out their history, what was done, what life has, what has happened in their life, basically with the weight gain or not. And then really look at the patient.
That makes sense. So, beautiful or not, a patient who comes in wanting to go from the size big BBL all the way back to their original pre-BBL. Can it happen?
So, not really, right? Like, nobody necessarily, I have yet to really meet somebody who comes in and says, I wish I was back to where my butt was before, right? There is a scale, so to speak, and I'll say to them, like, if 0 is before BBL and 10 is where they're at now, where on that scale do you want to go down to, right? And I'd say the lowest someone said is 2. Nobody said I want to go back to 0 where my butt was. Now they do say, oh, I wish I never had it done, right? But they'd like some element of the transfer, right? They like having a little more butt, but they're not where they're at. So that scale, sometimes they're like, take me down to an 8, take me to a 7 or a 6. 2 is, like I said, it's kind of the lowest. But I haven't had somebody really come in going, I wish I want it all gone, totally all out. Now, they may say that initially, and then when I go to tease it they're like, no, I don't want a flat butt. I don't want to take it all out. I want this amount off.
Okay, that makes sense. But so it's very rare to want to go back to the original.
It's rare so far. I haven't had somebody ask for that, but there are patients that are like, oh, I want most of it out. And I'm like, well, what does that mean? And then that's where you got to really talk to them about like where they want it. Where do they dislike their butt? Is it the front view only? Is it the side view? Is it too much projection? Is there a shelf that they don't like? Is it too dramatic from the lower back to the step off to the butt? Is it too wide, right? In general, so we really tease out where they don't like it.
In terms of the consult going beautifully or not as well, is it a good thing for a patient to bring in their BBL before and after photos to show you what they want reversed too?
Yeah, I always encourage as many photos as possible. And that's not always the case with every procedure, right? But with this one, it's great to know what their butt looked like before BBL. Like, what is their baseline? What is like them naturally and what is not them, right? Because a lot of like baseline stuff that was there is like always gonna be there to some extent, right? So there's some flattened areas of the butt that maybe they don't like now and they feel like have gotten worse or have showed up with the BBL. And then I look at their before photos, I'm like, oh, that flat spot was always there, right? So that's something that we'll always be dealing with. So these are important things to see and point out to patients because it establishes like realistic outcomes, right? They got to know like that may not change, right? Having the photos of their after BBL, like say if they followed up with the surgeon at 3 months and they took photos, like what did that look like? And what weight were they at that time, right? Are they now like 30 pounds more than that? And nice to see, now I'm currently seeing that. I also like for them to bring in wish pics. And it's not necessarily so I can get them to look like that outcome, but it gives me an idea of what they're thinking. Like, where do they want to see their butt? What kind of butts do they like? What is the shape that they're thinking about, right? Because then I can try to get them into that arena of that type of shape. Not necessarily that butt, because they do bring in some really amazing butts that are like super smooth and likely photoshopped and all these things. I'm like, well, I can't get you that butt particularly, but I see what you mean. Like their slope is a certain shape and yours is not right now, and that's what you like. So I need to target that area more than any other place to get you in that arena. So the manyest photos as possible, honestly. Like at least for me, because I think the more information I get, the more I get into their head of like what they desire, then the better I can achieve a result that they're gonna like. Yeah, because I gotta know what they're thinking, like because you can kind of do whatever with the butt for the most part. Like I can target and it's just full of fat, right? So it's basically like a block of clay there, right? And like I can kind of make it into whatever they want within reason.
Is it a beautiful idea or not for a patient to actually return to their original surgeon who did the BBL for the reversal?
It depends if the surgeon is comfortable with liposuctioning the buttock and the surrounding areas. It's a liposuction technique, right? And but it's different in the sense that it's very targeted and it's not a go in and remove everything out of the love handle to snatch the waist. It's about removing a certain amount to get them to a certain state. And you got to know what that amount is. Like, is it 200 cc's? Is it 5? Is it 600? Is it 800? So it's a little different than trying to remove everything as much as possible. And that's kind of the mindset for all other areas of the body, right? Like your arms, right? You get arm lipo. You want to remove as much as possible, keep it smooth, not over resect it. But the idea is to remove as much without tipping it over, looking done. But you don't want to really like leave stuff behind, right? You're leaving a little bit, but with the butt reductions, you're leaving stuff behind, right? Like you're not taking everything. So you know, you got to have experience in really doing it, or doing like, you know, for me, I do a lot of liposuction. I do a lot of thin patients. I do patients that don't have a lot of fat to take, right? So I'm kind of used to taking small amounts. Although we're trying to take as much as possible, but it's small amounts, and you got to be very respectful of the tissue because these are skinny patients with like real fine tweaking, and this is like fine tweaking in the butt. But going back to your original surgeon, it depends if they're comfortable or not with it, with doing liposuction in the butt. And I would say like a lot of surgeons are not, right? And I have seen patients go back to their surgeons, and then they get talked into doing more fat transfer because the surgeon's not comfortable with removing fat, and they're thinking, oh, patient doesn't really want fat removed from it. What they want is a better shape. And let me just put some more fat in some other areas to get them that shape. And that turns out that's not what they want. They want to be reduced. That's why I was saying the R is like reduction. They don't want to get bigger with a different shape. They want to get smaller with a different shape. Right? So don't transfer fat in to try to reduce the butt.
Okay, so then is it beautiful or not to add more fat to one side to balance out some asymmetry during the reversal?
So you can, right? So that's kind of next level stuff, right? In general, we're removing fat. All right, so like majority of patients come in and we're taking fat and that's it. Occasionally, I get some patients that are very haphazard, like they're too full on the upper part, not as full on the upper part on the opposite side, too full down, you know, on the out. You know, it's just this asymmetries, right? And so we might be taking in, and this part has a little dip, and we're adding to this side, right? So adding fat is an option. I do it. It's not as frequent, and I really tease it out with the patient. If I think that they need it to really get them to their best result, then I'll do it. But if I don't feel like that asymmetry needs more fat put in, it just needs strategic extraction around it, then we'll lean more into that. So it all depends. It's patient dependent. The majority of patients, it's just fat removal. Some we remove and place in other areas, but it does add to the recovery. It changes the risk, you know, complications, although complications are very low in our practice with this. But when you're taking fat out and you're adding, right now you're grafting, and that we have to go through some survival of that fat, and you have to try to baby that area. So it changes your recovery whole process, right?
Wow. So you really are a sculptor. You are taking away from this object to sculpt and leave this beautiful booty.
Yes, that's the majority of the procedure, in my opinion, is strategic extraction, right? It's strategic removal in certain areas to get the overall picture right.
Beautiful or not, waiting a month after a BBL reversal, a BBR, to decide if you need a second procedure.
So I like to wait at least 3 months, right? But what happens is, so I tell patients during their consultation that we're going to do this and we're trying to get it just right. I'm trying my idea and your idea, we're trying to overlap as much as possible. And that outcome, vast majority of patients are satisfied, but some may say, I like it, but I want more. And I like to wait 3 months before we make that decision, or at least consider it, because there's some changes over the first 3 months. The bulk of it is really in the first month. So some patients will start saying at a month, I like it, but I think I'm going to want more off. I say, okay, maybe. Let's wait until we hit the 3-month mark and take pictures, put them side by side, look at everything together, because some patients who said that at 1 month go, you know what, that's great. I don't want to mess with it anymore, right? Because things change. There's some swelling in certain areas. There's, things will come in. The shape kind of changes over a few months. And so at 3 months, we had that conversation. And if it's a yes, if I think that we can take more and get them closer to a happy place, then we'll start planning for that. And I'm fine with doing a second BBR 3 months and beyond. Now, some patients are on the fence. So like 1 month, they might say, maybe I want to have a little bit more. And then 3 months are like, I think I want to have a little bit more, but I'm not sure. And so I said, okay, well, let's wait another 3 months. Come back at 6 months. Maybe they got some weight to lose, right? Maybe they're 15 pounds overweight, and they're like, why don't you work on that a little bit? Let it heal a little bit. There are some changes that happen beyond 3 months. Very subtle from a surgical standpoint, but there is.
That makes sense. That makes total sense. Beauty seekers, remember to stay to the end, because Dr. Yovino is going to reveal the one thing that determines what makes or breaks a beautiful BBL reversal, or BBR. Dr. Yovino, beautiful or not, a surgeon doing a BBL reversal using the same technique and cannula approach as a standard liposuction?
I prefer small cannulas or micro cannulas. Technically, the specifics are 3 millimeter and smaller in diameter. I find the smaller cannulas in diameter lead to a smoother result, less fat removed with each pass. And so it's a fine sculpting. It's a slow takedown of the areas instead of large amounts coming off with each swipe. So I find that smaller cannulas are really crucial to really fine detailed work. So I think that's where surgeons have to kind of pivot. If they're used to using larger cannulas, 4, 5, 6 millimeter cannulas for, let's say, a lipo 360, I find that that's not good in the BBRs. Yes, we might be taking a lot off, right? And we may talk about volumes on how much to take off. If it's a really huge buttock, should we lean into a larger cannula, more than 3 millimeters? You can. The biggest I use is a 3.5, right? And that's if they're like really huge, but still, like, I take my time and just take down things really slowly, because I find that that's where you can keep things smoother. So I also find, from a technique standpoint, you have to move the patient around a lot, meaning you have to have them in at least 3 different positions: on their side, on their other side, and on their stomach. And that is done to approach it from all different angles. A lot of surgeons, I think, when they're working on the butts and when they're doing a fat transfer to the butt, really the preferred position's on their stomach, right? The patients are like this, the transfer is happening, and that's fine. That's the way I transfer as well. But I find, like, to remove the fat, you really got to come at it from the side, because you got to crisscross. And a lot of times the fat has been placed out into the hip dip area, which is now encroaching on to kind of the thigh, buttock zone. And to really get around that corner, it's like doing outer thighs for me. Like outer thighs, I always have the patients on their sides, because it's sitting on the top and you can really work on it. It's like working on it's on the table, versus like off to the side of the table. It's hard to work around the corner like that. So I like to have them in at least 3 different positions. And I think that's really important. And probably a lot of surgeons don't do that if they don't have any experience in doing removal of the butt fat. They just don't put them in these positions, because I didn't do that either at the beginning, right? It was like, okay, I'll let them be on their stomach. And I just found I couldn't get around the corner. So technically, small cannulas, take your time, and put them in a bunch of different positions. I also do a tumescent technique. So I put a lot of fluid in and really fill up the buttocks to just expand it, because it really frees up the fat in my opinion, and it makes it easier for it to come out. I think it helps with a smoother technique. I think it helps minimize bruising, minimize any bleeding when you use a tumescent technique. And also focusing just on reducing the butt and hips, not trying to do other stuff, not trying to be a hero and do their arms and their back bra rolls and the thighs and the butt trying to do all of it. It's too much. And I've met plenty of patients who have gone for a butt reduction somewhere else, and they had all these other areas addressed, and they found that the butt wasn't really done much, and there was too much attention everywhere else. I was talking about being hyper focused on the butt reduction and not multitasking, so to speak, into other areas. Like, it needs to be undivided attention on reducing the butt and the adjacent zones to get it right. So let's talk about anesthesia for the BBRs. My practice is very unique in that all the surgeries I do are in the office under local anesthesia with some oral sedation, but no general anesthesia. With this procedure particularly, the advantage of not being under general anesthesia is that it's easy to have the patient move. They will reposition themselves with my guidance. So they're on their side and I'll work, and then I'll have them turn all the way onto the other side, and then they'll turn and they're on their stomach with my guidance. When you're under general anesthesia, you can do these positions. It's just a lot more work. Your patients are totally out. You got to lift them. You got to make sure you're protecting all their extremities. And so it can make it more challenging. One is the repositioning. It's not a big deal to have them move, right? Because they're able to turn themselves. And so now it's like, yeah, I need a new position. No big deal. The local anesthesia, is also, I mean, in just a global sense, safer, right? They're not on an anesthesia machine. They're not, they don't have an IV. They're not getting all these extra medications. They're breathing on their own. They maintain their blood pressure. They're able to protect themselves. They're able to tell me when they're hot or cold, right? And I need a little more heat. Plus, to do it under local, you have to numb them very thoroughly, right? So I cannot do this procedure if the patient's not completely numb. So I'm very particular about how I numb them, and I do that very slow and extremely even, and I get them very comfortable. So when they're having the procedure, all they feel is vibrations and just pushing around. It actually is quite a pleasant experience. But in the end, when we're done, they're like completely numb. They're not waking up in pain, uncomfortable. They feel great, right? Because they're numb for many hours afterwards. But they put the compression on, they walk on out of the office.
Beautiful or not, trying to remove as much fat as possible to get the patient as small as they want in a single session.
Removing as much as possible, right? I mean, have I had patients say that to me? Yes. Doc, take as much out of there as you can. I'm tired of this big butt. Yes, I can take a lot out, but, I try to target what that amount should be based on what they really want, right? Because if you're like, I'll take it all out. Well, no, don't do that, because then I'll have a flat butt. Right. So we try to get it like, what is that? Is that 500 cc's? Is it, 1,000 cc's? Now, if it's a really huge butt, all right, like they've had 2 or 3 BBLs and their butt's like massive, right? They can't even get the regular pants over the butt, like everybody's staring at them because it's so big. That's not unusual to have at least 2 sessions to get them into their happy place. And so what's kind of the max I can take out with each session? Probably the most is about 1,500 cc's, like 1.5 liters from each side in one session. Right? Like, you have to be respectful of the tissue, and I don't like to deflate them too much in one setting. because it's a little hard on the tissue and there's a lot of retraction that we're trying to have take place.
This makes me want to ask. So we've got the booty, and you're taking out the fat.
Okay.
What happens to the skin around it as this fat just goes away?
So the buttock skin in general is pretty good. It contracts in quite nicely. I really haven't had issues with sagginess afterwards. And it's mostly, really only, in the lower part of the butt. So the overhang of the lower part, if I see that they have kind of diaper butt, right? Like this would be another kind of term of like shelf bad, right? Diaper butt bad. Diaper butt's like too much down in the bottom and it's just hanging down, right? From having so much fat transferred there. If they're coming in with that, then they're still going to have some of that in the end. But the skin does contract in, right? You take the volume out, it's like a rubber band around, a ball. Right? You make the ball smaller, rubber band's going to fit around it. If you make it so small that the rubber band like can't contract anymore, then there's going to be some looseness, right? So that is also some of the art of like taking enough to make it smaller and get them into their happy place, but not overdo it so much that they are smaller and loose. And that's where kind of the art of it comes into play. Now, people will ask, well, can't you tighten it with some lasers and devices and all that stuff? And yes, there's devices out there. I don't find that they work great. The lower part, if they're like, I want to improve my crease, there is some looseness to it, then that's where like skin excisions come into play, like removing some skin from around the butt or the back of the upper thigh. I don't do those procedures, but it is a possibility, and I will bring it up to them if they're like, hey, I'd love to have my skin lifted here or this tucked in. I'm like, well, then you're going to have to lean into skin removal potentially, but that would come after we remove some fat and see how you like it. And not, vast majority of patients like it just with the fat removal.
Beautiful or not, focusing on the buttock itself during a reversal without necessarily touching the fat that extends up or down on the outer hips or the side.
Yeah. So, I mean, like I was saying before, a hyper focus on the butt and the adjacent areas, wherever it's too full from the fat transfer. Now, sometimes patients are unhappy with the fat of the butt and all the areas where the fat has gone into, but they're also like, hey, I want my thighs to be in a little bit more. And now we're starting to venture outside of the area that had fat transfer, but it's right next to it. And so I'm okay with extending the removal to adjacent zones that are really like blending in with the butt and enhancement. But if we're talking about like into the lower back, into the love handles, into the back bra rolls, into the flanks, waist, or abdomen, I'm moving away from combining those areas at the same time as I'm reducing the butt in the adjacent zones. But I think like adjacent hips, yes. Butt, yes, obviously, but not really. I prefer not to go outside of it because I feel like it just ends up affecting the results.
Beauty seekers, we're getting closer to Dr. Yovino sharing the most important thing that determines whether your BBR, Brazilian butt removal reversal, turns out beautiful or not. Post-procedure, Dr. Yovino, beautiful or not, a BBL reversal result where the patient is smaller, but now has a still visible shelf or loose skin or regular contour.
So we try not to get into that scenario, right? We're trying to have them happy, and I think that's where the plan is very important to not get there. But at 3 months, taking pictures, comparing it to before, and I really analyze all these zones, and we look at it, and we say, okay, is there? Rarely is there like still a shelf, right? That one's, and I find easy to take care of, right? That's usually done. Is there still too much projection in the central component, or too much in the lower outer part? So if we're looking at the butt and the bottom outer part that's too wide here, we're trying to take that in but not causing a depression, right? That might still be too wide. Then we might consider doing more. And that's where we say, okay, is more in the cards? And is that taking a little bit more going to get you to your happy place? Or is it going to cause a new problem? Is it going to cause more shadowing in the area or some loosening of things? And I'll convey my concerns, or I'll tell them, hey, there's a risk for that or not. And then we decide, hey, should we be moving forward or not with it? But yeah, I mean, like, most of these things are approachable and can be addressed in the secondary procedure. The skin stuff is a little different story. Like if there is some hanging skin, well, usually that is only addressed by skin removal, and that's a little challenging in this area. From an incision standpoint in the buttocks or around the buttocks.
Dr. Yovino, before you let us know what truly makes a BBR successful, can you share a patient story that really brings the BBR experience to life?
Some of these patients, I think of a few of them, but one who was like, I'm so tired of being asked, where'd you get that BBL? Where'd you get your BBL? Or where'd you get that done? Right? And they're like mortified, right? At being asked this in public. Or they feel like they're going out and they're getting stared at all the time. Everybody's looking at their butt. And they're so self-conscious about it. And they can't find the right clothes, right? They can't get their pants over the butt, right? It's like everything's sticking out. They can get, there's room back there, right? Because it's sticking out so much. So they can't find the clothes. They're just socially having problems, and it's really affecting their life, right? So that part can be really satisfying for patients, right? Not only is it like, hey, we're reducing it, and they're happy about like their new size and shape and stuff, but now they can go out and they're not getting attacked, right? They're feeling comfortable in their skin, right? But comfortable in just their day-to-day life. And that's always very satisfying to hear from patients like, oh, thank you so much. I'm finally comfortable, being me again.
Before we answer the big question, does fat increase in size?
So I think the answer is yes, because patients, I've just seen patients, I've seen ones that have come in that really haven't gained weight, right? They had it done and years ago, and they might be a couple pounds, heavier, but not anything too significant. And they feel like their butt has grown, right? So I don't think the fat necessarily is dividing and making more. I just think that the fat cells are thriving, right? And they might be just taking on more fat and they're just kind of expanding. And definitely with weight gain, the butts get bigger. So those fat cells are growing in size. They're taking on more fat and expanding. I don't think that they're dividing and making more, right? They're just getting bigger. Just like when people gain weight, right? Like, their fat cells are expanding, this up and down. So for sure, these fat cells are growing in size.
But there's no way that someone who had a BBL could just lose weight and then lose their BBL. This requires a procedure.
Correct. They cannot go back to where they were before at all by losing weight, right? Like you got to have surgery to get it down. Now, I always encourage weight loss, or at least being at your ideal body weight, because then that's their best baseline. Fat cells are all at our like best size, right? And then that's how you get really the nicest result.
I love that. And before we close, can you share what kind of questions do you think a patient who wants a BBR should be asking themselves and their surgeon as they're on this journey to reducing their booty?
Well, I mean, they should be thinking about how much they want to reduce it. Like, how much really do they want to take it down? I think that helps get an idea. Like, if you just simply go, I want to be 50% of what I am now, right? And then you go, all right, well, how much fat was put in? There was 1,000 put in on each side. You know, what's 50% of that? That's 500 cc's, right? It kind of gets an idea of like how much to take, like a target, right? Like how much to take off. Um, to ask when they're finding the right surgeon, I think it's reasonable to say, hey, how many have you done? Right? Now surgeons may fudge on that number a little bit. It's possible and say, oh, I've done enough of these. Well, okay. You should look and see some before and afters, right? If they don't have any before and afters, then maybe that's not the right person for you. But somebody's got to start somewhere, right? Like I started with no before and afters, right? But I had done a lot of liposuction leading up to it. So a tons of before and afters with good liposuction. And I think that's the start. So you got to find a surgeon who does a lot of liposuction, in my opinion. So that's where having a lot of liposuction experience and a lot of good outcomes with liposuction is definitely the start.
Okay, this all leads us to the answer we've all been waiting for, Dr. Yovino. What is the one thing that increases the likelihood of a beautiful BBR?
Yeah, I feel like I should get a box and open it up, right? So you have to listen to the patient. I always listen. I always have full conversations with the patient, but you have to have a surgeon who really listens to what you want. And if you don't know what you want, they have to really tease it out of you. The patient has to be able to say, I'm too full in the upper part, or I have I'm too full in the middle outer part, or the lower part's bothering me too much. It's not really like, I'm just too big, fix it. Like you gotta be able to sit down with the surgeon and communicate what exactly you want, right? And if you can't do that, then you show some pictures of what you like and then keep talking. So and really that's it. The most important thing I've learned to get it right is to talk to the patients. And sometimes I talk to them 2 or 3 times, right? We have a consult and say, okay, am I the right guy for you or not? Are you comfortable? You want to move forward? Perfect. All right. Then day of surgery, I sit down and talk to them for a long time, again, about what exactly they want, what I think is good. Do they like that idea of what I think is good? Like we have a big conversation. Sometimes I'll see them for a pre-op before surgery. So it's not even the day of surgery. I have them come in or we do a virtual again, and we talk about this detail again. And we talk about we just go over all their desires again. And it's not unusual for them to like say something new, right? Because they've been thinking about it and they've been looking at themselves like, you got to have the conversation in depth about really specifically what they want. And then you got to try to follow that, right? Like then you try to execute what they're saying. So you got to you got to have a surgeon who listens.
Dr. Yovino, thank you for helping our beauty seekers understand what makes BBL reversal or BBR look beautiful or not. And today, you showed us that the surgery itself or the procedure itself is only part of a successful BBR. The consult, the goal setting, and the shared vision between the patient and surgeon are what seem to heavily influence whether the result is beautiful or not.
Yeah, it's a journey from listening, executing, and following up and listening some more.
Thank you so much. This is something every beauty seeker should be thinking about. You've really educated us about BBR, and we really appreciate your counseling us on what makes a successful BBR and spending your time with us.
Oh, you're welcome. My pleasure.
Beauty seekers, we appreciate you joining us. If you like the education we're sharing, please subscribe to Beauty Seek